Welcome to another edition of More, throwing out some heavy light. My name is Aljamal Bynum. I'm the chair of the board of directors. And More stands for Movement and I'm all for Race Equity. We've been around for over 10 years. We changed the name a couple of years ago. And we're very much excited to be able to bring different formats and different issues to the table. Today, this is a second event that we're holding. Last year, we had for the first time the three folks who deal with Inspector General, Ombudsman, and corrections on our MORE program, talking about some of the issues that they dealt with. And so we decided to bring them back again to give us kind of a status update, but also give them a chance to interact with the community in a different format. And so we're kind of excited where they can do that. Their offices deal with accountability in state government. And also, again, what we have today, they will respond to questions from the participants, and also part of our agenda is dealing with our mission related to accountability, transparent oversight. And so this is part of that program that we do. We do have a limited time today, and so we will ask the panel members to give a brief overview of themselves, and we also will limit our interaction, me and the panel members, to 30 minutes, then open it up for the audience or people to either through the chat or direct questions to them or comments, but we ask you to keep that brief. I will be obviously the moderator, and we'll hopefully, if we have a chance where there's some long-winded agendas, and we will follow up later after the meeting through their contact information that we'll make available not only on our website, but also in the chat box. They will be able to respond to you by email or phone call or whatever from that. And again, it can be very helpful. One of the reasons of doing these kind of programs with MORE and so on is to build social capital in our state with people who live in different communities, and more than that is to help us make our government a little bit more accountable to the people, and of course communicate and get more people of color involved in some of these issues. So without that further ado, I'd like to say welcome to our panel members, and we have Jennifer Carter, who's Nebraska Inspector General for Child Welfare, Doug Koebernick, who's a Nebraska Inspector General of Corrections, and Julia Rogers, who's an Ombudsman of the state legislative. And that office, some of you who don't know what the Ombudsman's office is dealing with citizens' complaints and so on. So we're kind of excited that all three of them could show up today and share some of the issues with that. And so first, I want to start off with you, Jennifer. Tell the viewing or participants a little bit more about yourself, and then we'll go in the sequence from there. So
okay, sounds
Jennifer,
great.
sorry,
Well,
Jennifer, go first. Sorry about that.
Yeah, no, great. Thank you so much for having us. We really appreciate being a part of this. As you said, my name is Jennifer Carter. I serve as the Inspector General for Nebraska Child Welfare. I've been in that position for about 2 years. It's a 5-year appointment, so I'm 2 years into my 5 years. Prior to that, I'm an attorney by training, but I had worked on policy and advocacy issues for a long time, and then served as legal counsel in the Health and Human Services Committee in the legislature. And both the Ombudsman and the Inspector General office, which sits within the Ombudsman's office, are part of the legislative branch. And as you said, is a government accountability office. So our job in particular is to look at the child welfare and juvenile justice systems and see how are they working? And we, by statute, have to do certain things. So we have to investigate deaths and serious injuries in those systems, but we also receive complaints, and that is really key to our work to know what is happening for people in the system. And then everything we do is as Julie will explain, it's a little bit different than what the Ombudsman does. We don't walk through a case specifically with the individual. We're looking at it from a much bigger system perspective, and we do conduct investigations and then try to make recommendations on what would be helpful might help improve the system. And part of it is also just like, as the law says, a performance review in the sense of transparency and accountability, and letting people know what we're seeing in terms of how it's working or not working. So that's kind of what we do, and I'm looking forward to the conversation and talking a little bit more about it.
Well, good. Next.
My name is Doug Koebernick, and I am the Inspector General for Corrections. And much of what Jennifer said can be repeated for our office, so I won't waste a lot of time. I was appointed to this position in 2015 and reappointed in 2020. The position was created as a result of several things going on within the Department of Corrections when the legislature created a special committee to look at all those issues. And it really was focusing on Nico Jenkins, but then it expanded beyond that. And part of that, one of the recommendations of that special committee was to create this Inspector General office and to model it after the Inspector General for Child Welfare office. So we're very similar to what Jennifer just laid out. We look at the 9 different prisons in the system. We look at the parole administration. We investigate all deaths, serious injuries, significant events, things like that, and any systemic issues that are out there that range from staffing issues to restrictive housing practices, classification issues, and so on. So we get out into the facilities quite a bit and have a lot of interaction with incarcerated individuals as well as staff members. And that's how we really learn about what's going on. We get out there and do that. Today I was at a prison, and Zach Pluhacek, who's Assistant Inspector General, was at a different prison. And yesterday we were at a different one. So we get out there and really dig in on as far as finding out what is going on out there. And then we do reports and make recommendations on how things can be improved in the system. That's a real quick rundown of what our office is.
Well, thank you. Julie.
Hi, I'm Julie Rogers. I am the ombudsman for the state of Nebraska. All of this we promote government oversight and accountability at a state level, with one exception, and that is county jails. So we take complaints about anything that has to do with state government, and anything that has to do with county jails. We also are the place for whistleblowers in state government. So if there's something that someone knows about something bad going on, there's a whistleblower protection type act, and we are the agency to investigate those whistleblower complaints. So we take complaints about anything having to do with state government, but the most of our complaints come from a few areas that have to do with really the most vulnerable, and that's where we have specific deputies. We have a deputy for corrections. We have a deputy for institutions, and that's veterans homes, regional centers, the youth rehabilitation treatment centers, and Beatrice State Developmental Center. And then we have a deputy for public welfare. So all of the DHHS programs. And we work to try and solve complaints. So we are informal. We work with our complainants to solve those issues, make sure they're treated fairly by the state government, who has responsibility to take action on some of the programs that they, by law, are required to do.
Good. Thank you. I'm gonna start in with my questions, and my questions, I will say up front, get a little bit loaded, a couple of them, but hopefully we can get through them. Doug, I'm gonna start with you first. You've been working on a series of issues related to prison reforms. I read your report about the fire at the Lincoln Correctional Center, misconduct report in April of 22, forging stuff against some of the inmates and so on, dysfunctional signatures of inmates, and also improper testing of drugs, so on, and making false allocations in the Department of Corrections. Briefly, the department members, they seem like they're doing some very malfeasance or corrupt agendas from someone who's looking at it from a different point. Reading your report, I saw that Director Frakes, he's no longer in town, obviously, but he responded in some of his reports we're looking at this as work in progress, but it was somewhat general the way he wrote that. And I want to ask you, in other words, and also going back to the issue of this inmates walking away, there's a lot of stuff there that can be unpacked. And I want you to give us a little bit more overview on why do prisons officials lack the wherewithal to address common agendas that are out there, and some of the stuff that you've raised in previous reports. So why don't you give us a little bit of overview of some of those things that seem like in Nebraska we should be able to take care of?
Yeah, that we've done a series of reports this last year, like you talked about, and when we go in and we look at these, we make findings and recommendations, and I think having a different set of eyes sometimes brings things to the department's attention that they hadn't thought about, and you kind of wonder sometimes why they didn't. But I think that's what our role is, really, to bring that other set of eyes and experiences into that so that we can identify things. But we also wouldn't, a lot of times our recommendations are made because we talk to the boots on the ground, and they are the ones who give us the idea. So it's not just us coming up with these findings and recommendations, it's getting that from people that are out there. And I think one of the challenges for the Department of Corrections the last several years has been to listen to the people that are actually out in the facilities and learn from them and ask them what they need, what they see. So when we look at like the walkaways, people walking away from the community correction centers, we found out that there's really a couple things that needed to be addressed. One is that there's not a lot of support for people when they go into the community correction centers, and they have a lot of stress that comes on them because they're really close to leaving and they have all these new things going on in their life. And there's a lot of family stressors that we found that they come across, and that results in some of them leaving. Other people have mental health issues, and what we found is that there's very, very limited mental health services being provided in those community correction centers. So we made findings and recommendations on that. And you might think, well, that's just obvious. We should have mental health care there. And we would know that people would be going through these stressors, and we should be able to wrap around some supports and help them and everything. But they weren't doing them. But now, we pointed out, and we're starting to see some action on that. And it may be a little slower than some people want, but those are a couple of really good examples of things that seemed obvious to us and weren't being done, but because of our role, they can now be done.
Good. Move down to Julie, in terms of the question. In reviewing your contacts with the various departments. Oh, sorry, let me go up to Jennifer, I think. Jennifer, I'll go with you. In your annual report you issued each year, there are many issues cited on your accounts and your reports. I noted that what caught my attention, the debacle or the mess up with the St. Francis has been a big issue in our community and our state for a couple of years, and each Eastern Service contract. The treatment of the youth in the YRTC, Geneva and Kearney, that whole issue movement and so on. And also just the whole juvenile justice confinement issue. Those were some issues that jumped out at us. And my question basically is, how can you and the department or folks clean up this for helping young folks in those detention centers? And Commissioner Kavanaugh calls them kiddie jails, particularly in DC, right here in our system. But my point to you is, how can we help issue and deal with some of these issues that you cite, and also deal with obviously education of the youth, because again, they are many youth who need good education. So there's a myriad of issues you cited. And again, the question I raised, as I did earlier, is how can we put closure to it and make it a little bit more efficient, so that we don't have some of these things keep popping up again and again?
Yeah, several things. So first, I would say there is an effort that our office is a part of, called Juvenile Detention Alternatives Initiative, or JDI, some people call it, JDAI.
Mm-hmm.
That group has been working and has had some legislation passed that is hopefully diverting kids who might have otherwise ended up in detention, but are able to stay in the community. But what I would say that overrides, to me, both juvenile justice and youth and detention centers, and what we're seeing in our child welfare system, is access to services. It is really sort of beyond a crisis point now in this state in terms of the services, and largely mental health services, but sometimes just general programming and skill building and things like that these youth need, that we really need the detention centers to be providing. And some of it is, what's the orientation towards detention, and viewing it as less punitive. And I think there has been some movement in that direction. But we have to acknowledge, and there's an increasing number of really young, to me, children, right, who are committing pretty serious crimes, but we have to remember that they are still children. And right. So how do we set up the system so that we are actually setting them up for success later in life? We're catching them so early. There's also all sorts of research now about emerging adulthood, and the brain isn't fully developed until 24 in terms of making those rational decisions. So I think more energy, more resources need to be put into actual services and how we are thinking about treating youth. In terms of confinement, it is a similar thing. How are we? The best practice would say we shouldn't be confining kids if we can help it. It has to be very limited. Clearly, these kids have experienced a lot of trauma. There are behaviors, there are safety issues. So we have to acknowledge that, but then what are the ways in which we can start addressing that beyond just saying, okay, well, I'm going to put you in this room for however many hours I need for you to calm down? because oftentimes that can be counterproductive, certainly counterproductive when you're dealing with youth with mental health issues. So I think looking for those types of solutions is really important too. In terms of education, what happened at the YRTCs, I think we're starting to see improvement there, and maybe there are lessons that can be learned and replicated across the juvenile justice system, and frankly, the child welfare system as well, where they're finally treating the YRTCs, the schools at the YRTCs, as its own school district, essentially. And it has a superintendent now. They're looking more at professional development of the teachers. The teachers are being supported more. There's a better communication about what the students are doing, both hopefully to there's a particular pilot happening in OPS where in terms of youth returning, so the schools know what classes did they take while they were in the YRTCs? What credits can we give them? What supports have they needed? And Commissioner Bloomstead of the Nebraska Department of Education, who is unfortunately in his final days in that office, but he is very interested and has been working towards how do we do that even in the child welfare system? How do we look at following the child and making sure everyone is understanding what that child needs, and as they frankly often bounce from place to place, and that can mean school transfers as well. So those are some of the things that the system's working on. I think there's something hopeful in how we have seen some improvements, but there's much more work to be done, and I am particularly concerned about access to services throughout the child welfare and juvenile justice systems, and everyone from every branch needs to come together and start to deal with that.
Excellent. Appreciate it. Thank you. I'll move over to Julie, I guess, and last but not least, in terms of the sequence of initial questions. Julie, I've been knowing you for a number of years. I know you've been working on some of these things, and I reviewed some of your contact information in various departments. You have a listing of all the people who contact you, and I was surprised with the Department of Labor was #1, and you had some other areas in there, and I wanted you to maybe talk a little bit more about that. And also, you also came with a flyer or something that I could see that's not always shared in low-income communities. I think that's very essential when in terms of dealing with the state government. But basically, I have a two-part I'm asking you is, how can we share this information more in our communities, particularly communities of color? And then part B would be, and examine your 2,830 cases, or at least incidents where you dealt with. Again, your Department of Corrections, #1. The Department of Labor, county jails was there, and then of course HHA Child Welfare. So explain to us a little bit why these numbers are like that, and particularly what are the underlying conditions? Are they just initial contacts, or there's some serious issues? So only you would know a little bit more of the depth of what we're looking at, and I couldn't tell just by looking at those raw numbers.
Yes, thank you. First, this is brand new. It's our it's our handy dandy brand new marketing. We are now getting into marketing our office, which we are so excited about. But this is not even a month old. Now, as you say, get these into the hands of especially the low income communities, North and South Omaha. Just I've talked to you about getting them into places like libraries and with nonprofits that provide these communities services. A lot of people really don't know what the Ombudsman's office does. It's a hard, sometimes word to pronounce. Even it comes from Sweden, so it is. People don't know about us. So it is very important to me that we get the word out about our office and make sure people know that if they feel like they've been unfairly treated, they can, by a state agency or county jail, they can come to us.
Julie, quick question. When you say county jails, does that mean all county jails in the state?
All county jails.
Oh, wow. Yep. We got some real problems in Douglas County, so wow.
Yeah.
Okay.
So as you hit on the top complaints, the top agencies we get complaints about, Department of Corrections, county jails, Department of Health and Human Services, particularly child welfare, and then Department of Labor. Now, I will say Department of Labor complaints have gone down this year, and that is because of COVID. Okay. During COVID, we saw a huge number of complaints about the Department of Labor and how the unemployment benefits were being given out to the community, especially anything coming from the COVID dollars. This year, the numbers are still higher than pre-pandemic numbers for the Department of Labor. Excuse me, but all of these agencies and topics like child welfare, these are very vulnerable people. And I think that's no, sorry, I have a tickle in my throat. That's no, I guess, surprise that that's where state government might be having the hardest time, is serving the most vulnerable. And we find that that is where most of our energy and work goes into. So, I mean, and a lot of these populations, there's a disproportionate number of Black, Hispanic, Native Americans in the prison systems, in the county jails, in our child welfare system, and in institutions like the juvenile justice system. So we know that that's an issue. So I think some of that is underlying all these things as well.
Good, thank you. Now, what I'm gonna do is I'm gonna throw this out to anyone. I mean, just throwing it out there. One of the questions I have is sending all your community council and outreach to resident states. What have you done to get the word out about your offices or the increased opportunity to get the public involved in our state to deal with your reports, follow up, and just communicate with you in general in your respective sites? And I do know you don't have PR people working full time for you like some nonprofits or whatever, but talk to us a little bit of what have you been doing to try to broaden the scope, or at least flatten the pyramid, as we say, of getting information out to our state as a whole.
Well, Julie showed that great new piece that actually explains what the Ombudsman's office does. So that's super. And we're hoping to do the same thing for the IG's office. Some of it is I have started whenever I'm asked to present or the IG's office sits on a bunch of committees and commissions and whatnot. So particularly when we've got other groups on those that do direct service, I'm finding that no matter what I'm talking about, I'm adding in sort of a 101 on what our office even does, so that maybe people will think about directing people to our office. Obviously, whenever we do a report that we can make public, we do see a little bit, I mean, it's usually minor in numbers, but we see an uptick in people contacting us when we've gotten some press on what we do. But frankly, I would like to do a lot more. I'm grateful for this opportunity. I would like to work and do even more community forums, you know, kind of town hall type things where we can just let people know, here's what we do. And it might not always be in that moment that we can speak to the person or be the best place for them to talk to us, but hopefully they would then know that we're there. Because particularly, you know, we don't know, there's certain things people have to tell us, the state agencies have to tell us, but otherwise we need to hear from people in order to really understand what's happening in the system. So those are some, but I'd like to do more of it.
Good. Any of the other two, you want to respond to that question?
Yeah, I mean,
you already responded your answer a little bit there, but yeah, any other feedback?
You know, our office, we do a lot of press contacts. We get a lot of coverage because of our issues are just out there. Like corrections, it's easy for people to understand and for the media to understand. So we have a lot of stories that get out there in either the print media or the television media, and so we have some recognition from that, and people contact us as a result of that. I've met with numerous community groups over the last few years whenever they wanted me to come out and talk to them. The Criminal Justice Review is like a quarterly newsletter. I just put something in that for their next edition.
Now you lost me on the criminal justice. Is that the one that comes out of the church in Omaha that they sent out to people? Okay, what is it? One of the churches in North Omaha or off of downtown.
Yeah, Holy Name, I think.
Right, there you go. Maybe it was state meeting at that point. The Holy Name is known for that for years.
And we've done some other outreach opportunities, and including the last couple months, I did facilitated a 5-session class about corrections at the university here in Lincoln. And we had about 80 community members that attended that either.
Oh, inside the university. Okay, good.
Yeah, so that was really good. And I think that really helped out too. So we're always trying to be creative and get the word out.
Good, thank you. Julie, do you want to say anything?
I just, especially with corrections, county jails, and any of the institutions, we really try, and I try to emphasize people going out into those and visiting the youth rehabilitation treatment centers. Doug does a really good job at going out into the correction centers. Jennifer does a good job at going to the youth rehabilitation treatment centers too. So we really do need to get out more than that, but I think that is a focus we can certainly improve on.
Yeah, we're getting down to the last 5 minutes where we open it up, and I got one last question I'll throw out at you is, the last time you were on the program about a year ago, we talked about the issues of race, disproportionality of individuals of color and being adversely impacted. And again, I will share it again tonight, of, these various government entities having problems with public, for the community. And so how have you, or do you collect data by race and geographic data and so on, to address some of those anomalies, particularly disproportionality? So in your own reports, do you use race or geographic areas of some of the recipients of your services, of people who contact you? Is there anything like that in your respective areas or departments?
We do not collect race or ethnicity in our intakes. We do collect information on geographic locations. So that is a start. And we do take complaints and have had complaints about if someone feels like an agency has discriminated against them because of race or ethnicity. There is the NEOC that we can send people to if the complaint reaches that level. But sometimes it might be a complaint about, I feel like because of my race, I am in this prison setting or this classification within prison rather than this other one that's more sought after. So we would look into that and gather information from other agencies.
Good.
The
Okay.
last time we were on here, I talked about, I think that we had made a recommendation to the department that they work with us and we do a study on race, because we've done some data as far as disproportionate confinement in the past in our annual reports. They didn't act on that, but we are committed this next year to doing that with our office. We're going to do our best to kind of dig into that issue. There's a really, I think a really solid report that came out of Iowa from their Department of Corrections, that they did a racial disparity report. That's a good model, a roadmap for us. And so we've been looking at that, and we're going to kind of mirror that in a way and look at race in the correction system, and we'll try to do parole as well.
Good. What? Go ahead, Jennifer. You want to say something?
Oh, just that similarly, we're trying to collect, we can voluntarily, I guess, collect identification of race and ethnicity, but otherwise sometimes if we can look into documents, if somebody's in the system, we can identify it that way. So we're trying to do a little bit of a better job tracking to see if we can see any trends. And obviously in any particular investigation, I'm sort of trying to move the office to encourage us to at least view it from that lens, depending on the situation, to see if there's anything there. It's again tricky because it is never going to be a picture of the system in full because it's just what comes to us. But I think it's obviously really important to start trying to figure out how we can work that more into what we're doing.
Good. Now, folks, we're right at the halfway point or close to it, and kind of the format what we normally have done is we sometimes called an audible. For those of you who don't know football jargon, is like you look at the play and you switch up. So what we're going to do is go through some of the chat, and we'd also like you to open your mics up and ask a question directly, so it makes it a lot more interactive. We do ask you not to make it long-winded because we only have 30 minutes and we want to give as many people a chance to share what they want to share. And also we have their contact information in the chat, so you can look at that for an email, and then obviously just do an internet search. You can get their phone numbers if you want to call their respective offices. So we're kind of excited about that. But one of the questions that came up here, and Sister Cynthia, do you want to ask that question directly or make your comment? I mean, because I like to hear people's voices if possible instead of my own all day. I get tired of saying it to myself.
Okay.
Sister, you there?
Yeah, I'm
Okay.
here. A while back, I organized a presentation on childcare, and one of the pieces of information was around the child tax credit. So as I'm listening to the idea of oversight and accountability and transparency, I thought I would just raise the questions about which I send in the chat. I don't have them in front of me because I typed them.
Well, I'm looking at it. It says, do 20% have any options? Do any of you have any oversights into how are these funds monitored?
Yeah, that 20% was on a site that is, I was just looking for an update on what's the status of it. And I couldn't get into the site to read what was there. So to have that many families be too poor, I thought, well, maybe those are the kind of people that contact you for resources and help. But I was just, I don't know what this research is talking about in detail, but it drew my attention because I'm concerned that if the tax money from the rescue plan was often given to those who maybe didn't have as much need, or businesses were calling into you, maybe there were calls from families regarding this tax credit situation.
Julie, I see, look at are you going to respond, Julie? I saw you give it no trouble like you want to jump in on this one.
Yeah, we did. We don't have any oversight over anything that deals with the federal government, but if the federal government gives money to the state to distribute, like some of the COVID funds, and we get a complaint about it, we certainly would be able to look into that complaint to see if, I mean,
so was any money given to the state to disperse? I guess that's a piece of.
Yes, there was. I'm not sure exactly on the child tax credit, but there were some like child care funds, I know, given to the state, some funds for housing, that sort of thing. We did get a few complaints about different programs. I just don't recall off the top of my head. I don't think we've gotten any complaints about the child tax credit. If that would have been a federal program, we could have found like an inspector general that would have had accountability and oversight over that program we could refer people to. But certainly if that money was given to the state to disperse, we would have oversight and jurisdiction to look into those complaints.
Good. Folks, we got questions coming in on Facebook, and somebody just texted me that I know, and her question is a little bit different. She says, I just got off of work and I'm looking at Facebook Live. My question is, were there goals or are there goals served for primarily white students and families in some of these institutions, I guess? Are there anything like that going on? Do they do anything on race in those education institutions? I guess would be YRTC, because you hear a lot of stuff with some of the issues dealing with, I guess, students of color. But is there anything that specifically we talk about some of the dominant groups in our state in those institutions? Or are they in those institutions? YRTC or D what?
You know, I mean, certainly yes, they are still there. Obviously, Black, Hispanic, Native American youth are disproportionately represented in those institutions, but there are certainly still, probably still a majority white youth in those institutions when you look at the entire population. But
I did not know that. In Douglas County is different though, but in the state is different. So it's predominantly white.
Yeah, it depends. It depends at any moment on their census, obviously. Okay. But I mean, certainly it is not. They're not disproportionately represented at all.
Okay, the white students, that is, okay.
But in any given moment, you might have, you know, a different proportions of youth there. But I don't know that there's anything specific in terms of the educational curriculum or how they're approaching it that has any things specifically that they deal with in terms of, I'd have to ask some more questions, but it's certainly nothing that's been presented to us in terms of the work they're doing around education in those facilities.
You know, when I was attending the Children's Commission meeting, I remember hearing some of the people from the Department of HHS talk about the educational stuff, but again, it was reported from their jaded or their perspective versus some other objective entities and so on. So I don't know what's going on there in terms of quality of education. I don't know what's going on. And that, I guess that might be all one of the questions that's laid there. We got another question coming in here that I'm gonna throw out there. Truancy diversion service are primarily provided to white students, as I understand in Douglas County. Do you know anything about the truancy or the diversion program in Douglas County? Have any of you seen any of that? Deals with child welfare, I guess, or anybody complain about that?
We have not, so I'm really interested to hear that. We haven't heard a lot about truancy diversion, period. I know that they have it in Lancaster County as well. I think it works a little differently in Lancaster County. So I'm sorry, I don't have more information on that, but this is exactly why this kind of event is so helpful to our office, because now it's a question I can ask. So.
You know, when I was with Douglas County, and again, I'm not speaking out of school, but that was the hardest thing to get was the diversion data by race. And I actually attended a meeting and one of the functionaries said they were going to get me some data and it wasn't always forthcoming. But again, some of that stuff should be on the web page. And again, if we're serving kids or young people, we need to be able to toot our horn if we're doing good and if we're doing bad, and we can't fulfill what we need to do. We need to give a cry out to the community or other entities to help improve that. So again, I would love to see some diversion information in some of our juvenile justice systems. There's another question here. Is there a connection between truancy and child welfare in Nebraska? And Jennifer, I think that might be aimed more at you.
Yeah, I mean, I would say there is two different ways, as I understand it. You have the potential of a child coming into the child welfare system if they're not showing up at school on a regular basis, and the parents might be cited for educational neglect, and depending on what else they find in the home, I mean, that's sort of the entry into looking into the home. You might have a child end up in the child welfare system, and then separately as the child gets older. So I think, so that's where the connection would be. A lot of times, otherwise, truancy is going to be more on the juvenile justice side, particularly when the child is older, and then they might, get cited for that. I mean, that's a status offense, and so that's where we see the connection there, and that's something that I've even heard from county attorneys who would like to work on that, because they often know that when you're seeing a truant child, there can be oftentimes issues in the home that child's dealing with. So how do you actually support that family and figure out what's going on there in order to address it, rather than make it something that's ending up in the justice system? So. Okay,
good. Other questions, other feedback. Also, you can open up your mic if you want to ask a question directly to the guests or the participants, the panel members. Other feedback. Anything in the chat? I can't see the chat. My system messed up. Is there something in the chat that jumped out at us? Oh, I see, Suzanne, you got something there?
I have a question. I don't know if this is really appropriate for the panel, but what's come up to me as I've listened, and maybe Doug, you know about this. So the men that are at the Nebraska Youth Correctional Facility, is there any responsibility by OPS to service educational needs there, since they're in the OPS district?
None by OPS, but they do have a school district that is run by the department that is falls underneath the Department of Education, as far as, they have to follow all the rules of a school district and everything. They even have a school board for the Department of Corrections. It's made up of people who work within the Department of Corrections, but they do actually have a school board and a principal and teachers that are unionized and everything. So it's like a regular school. And so anybody under, I can't remember what the age would be, under 19 or 21, they are taking classes and working toward their high school diploma or their GED. So there's a lot going on, but it's not affiliated with OPS.
So is it a requirement of all the men? All the men who are at youth facility?
Yeah, I mean, it's something that they are very strongly encouraged to take. I mean, sometimes you're going to have young men that are going to say no. And I'm not exactly sure what they do in those cases. I've never looked at that, but I mean, they are supposed to be taking classes. They're supposed to be offering the educational opportunities to those young men. And if there's any young women in the facility in York, do the same thing there.
Oh, okay, so the young women would go to York, probably not to youth here, because it's men only at Omaha, right?
Mhm, mhm. Yes,
I read your report, but I don't remember her saying that part in it. Thank you.
you're welcome.
There's a question in chat. Are the state agencies cooperative as you're conducting your investigation, or is it sometimes a barrier? And then the other thing they asked is, man, it jumped out at me. Are there things that we can advocate for that are those barriers that would help you make, I assume, your job more better or efficient? So are they the people sharing your love when you go out there and deal with some of this stuff? Are you finding it difficult, or do you need more community or state input to make your job a little bit more easier?
Sometimes they are very transparent and fast to respond to us. Our favorites, I will say, are the Department of Revenue and Nebraska Retirement Systems. They respond really well. And then there are some agencies who that is not a priority to respond to us when we reach out with, like Department of Corrections, we get all sorts of just in the Department of Corrections, we could get medical concerns, dental concerns, mental health concerns, concerns about classification, concerns about write-ups, loss of good time, all sorts of issues. So it really depends on the leadership, I find. If the leader of an agency says government transparency is very important to us, you shall respond. That is my expectation. We usually get a better response from those agencies. But if the leadership is very defensive and very doesn't show that that is a priority for them, we find that then it is harder to get information. And I know the inspectors general have each had their own challenges with transparency and getting the information they need to do a thorough investigation.
So Doug and Jennifer, you got anything to add to that? How they show your love or not show your love and try to do your reports?
Yeah, I mean, I would say we have had a really, since I've at least, and I think Julie had the same experience when she was IG. In general, the Department of Health and Human Services has been transparent, responsive. As soon as we send a notice of an investigation and ask for certain documents, they're working on it. We do get them. We can interview the staff, all of that we need to do to conduct that investigation. So we have really appreciated that. We have a big challenge on the juvenile justice side. The Office of Probation has come, and I mean, they've come into the legislature and testified regularly that they don't believe there should be oversight, certainly not by our office. So there are certain things, we get documents from them when we ask for that. They report certain things, notice required by law to us. So there are ways in which they are transparent, but we have some challenges with difference of opinion on protocols and being able to actually conduct necessary interviews to complete investigations. So I think, ultimately it can be somebody else, but I think in general, the legislature needs to decide if they want to have oversight over the youth that are in the juvenile justice system, then certain tweaks may need to be made to allow for a really full investigation and integrity in that process. So, but otherwise, we've been pretty fortunate.
There's another question in the chat. It says, Doug, you mentioned GED is part of your oversight. Please comment on the success rates of taking and are completing while incarcerated.
I actually don't have that data. That's nothing that we've actually looked closely at. But that probably should be. I'm going to write that down.
Well, good. We heard it here first, y'all. Moore's bringing you some heavy light. It's good. Okay.
Yeah,
We'll follow up on that.
We'll look at that.
Good. There's another question that jumped out, and it's Mark Welch. I know he's with Nebraska Peace. He says a large percentage of inmates are there because of mental health problems. What percentage of them do you think would do better if they were on medication, mental health, and mental health drugs are they available to them? So that's from Mark Welch.
Yeah, we know that there's a very high percentage of the incarcerated population that has a mental health condition or serious mental illness. And there's lots of different numbers out there as far as how prevalent that is. But they do have psychologists and mental health therapists. They do provide treatment and prescription drugs for people who are prescribed those by a psychiatrist. So they do provide treatment. Their challenge in the Department of Corrections right now, I'd say two things. One is they do get a lot of people that do have serious mental illness who might be better served somewhere else.
Right.
I think that's across the country. So that's nothing new to Nebraska. And then the second thing is that they have a behavioral health staffing shortage. And the last time we looked, there's supposed to be 18, I believe, psychologists in the Department of Corrections, and only 6 of those positions were filled at that time. A lot of the mental health therapist positions were vacant. They don't have any psychiatrists that are actually employed by the Department of Corrections. So they have some challenges with their staffing, and so they are spread pretty thin because they not only provide treatment, but they also provide programming like a violence program or substance abuse treatment program, sex offender program, things like that. So those are some real challenges for those people. They have a pretty tough job, and I admire them for what they do, and they get some pretty good results, but they're challenged by their lack of staff.
Good. You know, I was going to throw in the question, kind of a wild card question. I guess it could be aimed at all three of you. You operate as separate domains and so on. How well do y'all interact or communicate? Do y'all have meetings as a different division to deal with stuff? Do you see each other's reports? How does it hierarchy, or is there one on the various roles that you have? How do they interlap or overlap, or however you want to put that? And I guess Julia or Jennifer, you can respond to that.
Sure. So the whole office is called the Office of Public Counsel. And so we each have a role within that office. Each of the inspectors general's offices are within our office. We all come to work at the same office. We have staff meetings every week with all of us. And then we have a corrections meeting once a week. So the folks doing the ombudsman's complaints and Doug's shop, we can coordinate and collaborate and make sure we all share information. And then the same thing with a public welfare meeting once a week. And then reports that are done, we share reports amongst us to make sure that we're all on the same page, and what's going out of our office, we all know about, and we have knowledge about that. And if there's anything I'm forgetting, Jennifer or Doug?
I don't think so. I think it's incredibly helpful, again, because for us to understand what's happening in the system, aside from, I mean, as Doug described, visiting facilities, but then we can hear from the ombudsman side what kind of complaints they're getting, and we can share with the ombuds side, here's some systemic stuff we're hearing about. So in case you start seeing it, or if you want to anticipate in terms of individual complaints. So it's very helpful to coordinate in that way.
By the way, I got another call, and not call, but another question that jumped out at me, and this is, I guess, how we can read. It says, how many Nebraska minors are sent out of state to residential treatment facilities? That's one question. What kind of breakdown of children to these facilities, child welfare involved versus juvenile justice? And what is the racial breakdown of children sent to out of state? How much money is spent? So there's a lot of questions there, but one is how much money is spent on sending people out of state in that whole philosophy. Is there a report or something you can talk about when we take our young people and form them to these other states, and should we not be doing that? So it's kind of a generic, lot of questions. And how do you respond to some of those questions, or can you?
So, yeah, I would say we do have youth out of state, and sometimes they are in the child welfare system. Sometimes they might be what they call duly adjudicated, meaning there were issues in the home, so they were made wards because they were child welfare related, but actually they also have some kind of status offense or crime. And so the child is also in the juvenile justice system. I want to say the last number I heard was maybe 24 or so youth in out-of-state placements. The foster care review office actually has a dashboard that will tell you how many youth are out of state. I don't know about the dollars off the top of my head, or I might have to look up that
Well,
information.
Jennifer, here's my question. These are some very important data that we should have out there on the public website. And I know when I worked in Douglas County, they would hide data or they wouldn't put it out there. You'd have to have a PhD to find it on their webpage. So basically what we're asking is, how can we get that data out there and how can we be more transparent, particularly when it may be beyond our bell curve in our respective jobs, but there are other agencies and nonprofit that does advocacy, public policy, things like that. Because again, a lot of times in Nebraska, we have no clue about information. And I remember years ago, Voices of Children back in the day used to get stuff on the national level before they can get it from our state agency. And so my basic question is, how do we make this stuff out there so that at least we know what we're talking about versus people who work in state government having their little inside huddles and keeping stuff to themselves?
No, I think that's a really good point. And I would point again to the Foster Care Review Office has a new dashboard on their page that gives a lot of that data. Voices for Children is hopefully by, I believe, February or March, will be coming out with their new kids count data. So that again has a lot of that type of information. In terms of the specific dollars, though, that I'd have to think about how to get to that, although I agree with you, that should be publicly available information. Those are two of the best data hubs in the state for child welfare and juvenile justice data that you'd be looking for. So they do have that, but once again, they are getting it from the state agencies, as you said. So otherwise, I think it's also people asking questions, state senators asking questions for that kind of data, those types of things.
All right, now we're got about 10 minutes left, and I want to give each one of you a chance to close the comments. So I want to just maybe get to a couple more questions. It says the state ombudsman. Let me see. No, I'm going to go to this one. It says, is there any attention paid to immigrants and refugees? You know, we have one of the highest student needs population. Recent years, we've seen a lot of people coming from other countries to Nebraska because of unemployment opportunities, but also because of secondary migration, having relatives here and so on. And since to each one, what is your expenditure or what do you deal with some of those people who are from outside of our country or migration, folks from other countries? Do you have any insight or dealing with the newcomers to Nebraska who are refugees or immigrants?
So we certainly get complaints if an immigrant or refugee is having problems accessing state services. I think about one example that comes to mind is in child welfare. If an immigrant gets their children taken away and maybe the caseworker is not familiar with that particular culture and there's some miscommunication going on. And so we might come in and try to explain things to see if we can get everyone on the same page. I mean, that is a very simplistic case, but we certainly take complaints from immigrants. The hard part is if they are calling in, we would rather have them write to us the complaint because we do not speak a bunch of other languages and some people just do not speak English. And so that is a challenge that we run into.
Joe, hold on, just a question. Yeah. Are you saying if somebody calls and they don't speak a certain language, we don't have access in Nebraska to some translators in state government?
Well, we do, but we try to get them to write us first because we don't have any way in that very moment. I mean,
I'm putting you on the spot. When you say writing, you mean writing in English or writing in their native language? What do you mean? You lost me.
Either one.
Okay, gotcha.
Either one. They can write us in their native language. I'm just saying a lot of people do call in with complaints and we would have them write. And we do try to figure out how more people can have access to our office. But refugees and immigrants certainly do have a challenge in accessing a lot of different state services.
Good. Folks, we're down to the last 5 minutes. And again, this year we only had an hour versus 90 minutes last time. So there were still some questions I didn't get to. And we really appreciate each one of the panel members sharing their point of view and so on. But before we close out, I'd like to maybe give them any last comments or things you want to say for the audience. And by the way, their contact information is on in the chat box, and you can find it by doing a Google search in their respective offices, their phone numbers and so on. But let's start with anyone. Is there anything you want to say to the audience out there before we move on?
You want to go for it? Well, I would just say thanks again for this and for all the thoughtful questions. I did see one on the YRTCs, and they do have a psychiatrist who oversees all of the facilities, and then they have a supervisor of mental health practitioners in each facility. So I would say I really appreciate this. I would encourage people to feel free to direct them to our office, and we can, if they have got an individual problem, we refer them over to the ombuds. So hopefully we are both getting the information to help us address the systemic issue, but they might also be able to get particular help on their individual case. And so, and if there's other places that you want us to talk about our work, we'd be happy to do that.
Yeah, thank you. Anything else on your part, Doug? Really? Closing comments?
I will go. Thank you for inviting me. If I'm invited, I really like to say yes if I can. So I try to make it a priority if I'm invited to speak somewhere about the office. That is part of the important work of getting the word out about the office. So thank you very much. I think you all have contacts with a diverse group of people throughout the state. And so if you think of us, if you were talking with people struggling with a state agency or government, sometimes we know, even if it's not a state agency, sometimes we know where to send them. But I really appreciate it.
Yeah.
Thank you.
Doug, do you want to say anything closing?
Yeah, I think the final two things I would say is, one is that we're really lucky to work together with the Ombudsman's office, because they have a lot of experience and expertise, and they dig into those individual issues, and we learn so much from them. And the fact that we're all together and part of a team is really great. I mean, I'm very lucky because the Deputy Ombudsman for Corrections, James Davis, has been doing that job for a long time, and I'll never approach his level of knowledge and experience, and he's always willing to share it with me, and I really appreciate that. And then the other thing is that if anybody out there has any thoughts or any experiences with the correction or parole system that they want to share with me, or they think there's things that we should be looking at, just reach out to us anytime. We love hearing from people, and we try to look at as much of the system issues as we can. And I appreciate the opportunity tonight.
So we had a couple of people say they really appreciate y'all coming on. And again, this is kind of a rarity. As a resident of the state, we have not had with the three folks in for this responsive positions to come together and do this communication to our community. And again, this is posted on our Facebook Live as well on our website, so people can watch this afterwards. And one of the things we learned and more is that we get a lot more traffic after the event because people have other commitments. So really appreciate each one of you being here tonight, and again answering questions. And again, for those people who didn't get their chat or questions answered, you can follow up individually. And we also share with folks in the past that we don't want people to put their private stuff out there in the public domain when they need to get something resolved specifically. But there are a lot of times what affects you as an individual affects other people in our state, in our community. So we want to share the love and get people to do what we call village advocacy, so it can help all of us and so on. 2 quick points. Number one, there's an evaluation form we ask participants to fill out, which helps us direct us to future events and forums. And again, these are the kind of things that are driven by people saying, let's do it again. And again, I appreciate each one of them, Julie, Doug, and Jennifer, coming back again to talk to us about it. Hopefully we can get more public officials to hear this, because I think you shared some good light about things that we need to be doing better as a state. So I really appreciate that. The last point I'd like to say is we'll be bringing some innovative programs in 2023. We're going to probably start do some hybrid programs where we'll be out of community centers and then use an audio computer or whatever camera to have people who may not live in the community, may not be able to travel because of this COVID-19 situation. So we're going to probably do both 2023. We also want to spread the love out amongst other people. So we encourage you to suggest to us things you want to do. And we also want to enter into partnerships with agencies that deal with anti-racism, race issues, diversity, because we live in a climate and a state today where there are some people saying we shouldn't talk about these things. And we know in order to address any kind of issues, you have to bring it to the table and bring people together, goodwill to solve that, because again, it makes a better Nebraskans, but it also makes it better for those families and also those children who are not yet born. So we hope that you would join us in the future for other events that we do. And more than anything, we want people to see that Nebraska is a place that we can thrive and challenge each other and respectfully have answers to these solutions that we shared today. Last question and point that I want to raise to each one of the panel members, in a sense, more of a rhetorical question, is we got to figure out how to get more people involved in some of the heavy lifting public policy, because we have a unicameral and many of our state senators are a lot more responsible to getting back to their constituents. So we hope that these opportunities will bring people out to see that public policy and social justice work is something for all of us and not the work of the few doing the work of the many. So on that note, I would like to say thank you again for tuning in today. As we always end, may the force be with you, and Baroko.